Right now, as you're watching this, your liver is silently performing over 500 functions to keep you alive. But here's what nobody tells you. You can lose up to 75% of your liver function and feel completely fine. No pain, no warning, nothing, until it's too late. In the next few minutes, I'll show you the 5 signs your liver is already struggling, and exactly what to do. Stay with me because sign number 4 is the one most people completely miss. My name is Dr. Kyle Healthman. I'm a physician at MedAI Clinic, specializing in internal medicine and preventive health. Every single day, I sit across from people who tell me, "Doctor, I had no idea. I felt completely fine." That's exactly why I started this channel. Real medicine, real science, straight to you. Now let's talk about your liver. It filters toxins, produces bile, regulates blood sugar, stores vitamins, and controls key hormones. It is, without exaggeration, one of the most vital organs in your entire body. The liver has no nerve endings. It literally cannot feel pain on its own. That's why doctors call it the silent organ. Your body communicates liver problems through other signals. Signals most people dismiss as stress or aging. Let's go through them one by one. Sign number 1, chronic fatigue that sleep doesn't fix. Not just tired after a long day. I mean waking up exhausted, feeling foggy by noon, needing coffee just to function every single morning. When your liver is overwhelmed, it can't convert nutrients into usable energy. Your cells are starving even if you're eating well. A 2019 study found that over 65% of early-stage liver disease patients reported persistent fatigue as their very first symptom, often years before diagnosis. Fatigue alone means nothing. Combined with what I'm about to show you, it means everything. Sign number 2, unexplained changes in your skin. Your liver removes a yellow pigment called bilirubin from your blood. When it can't keep up, bilirubin builds up. Yellowing of the skin or whites of the eyes is called jaundice, and it's a medical red flag. But subtler signs appear much earlier. Itchy skin with no rash, spider veins on your chest, dark patches on the neck or armpits. These are your liver sending an SOS through the only surface it can reach, your skin. Sign number 3, persistent bloating and digestive issues. Your liver produces bile, the fluid your body uses to break down dietary fat. When liver function drops, bile becomes inconsistent. Result: bloating after meals, nausea, feeling full too quickly, alternating constipation and diarrhea. Millions of people treat these symptoms as IBS, never realizing the root cause is the liver. Quick self-check. Do you feel sick or heavy after eating fatty or fried foods? That's your body struggling without enough bile. And now, here's where it gets really interesting. Before we get to signs 4 and 5, and sign 4 is the one most doctors don't even mention. If you're finding this valuable, hit that like button right now. It takes 1 second, and it helps this information reach people who actually need it. And if you haven't subscribed yet, we publish new videos every week, exactly like this one. Okay, sign number 4. Sign number 4, changes in your urine and stool color. I know, nobody wants to talk about this, but this is one of the most clinically accurate early indicators of liver stress, and almost no one connects the dots. Dark brown or orange urine, consistently, means bilirubin is spilling into your urine instead of being properly processed by the liver. Pale, gray, or clay-colored stools mean that bile is no longer reaching your digestive tract at all. These are the exact clinical signs liver specialists look for immediately when a patient walks through the door. If you've noticed either of these, please don't push it aside. Ask your doctor for an AST, ALT, GGT, and bilirubin blood test. It's inexpensive, and the information it gives you is genuinely priceless. Don't wait until your body stops asking and starts demanding. Sign number 5, a dull ache or pressure in the upper right abdomen. The liver itself can't feel pain, but the capsule surrounding it, called Glisson's capsule, absolutely can. When the liver becomes inflamed or enlarged, it stretches this capsule, creating a dull ache just under your right ribcage, sometimes radiating toward your right shoulder. Most people chalk it up to a pulled muscle, gas, or sleeping in a bad position. If this discomfort keeps coming back, even mildly, do not ignore it. Your liver is one of the few organs that can fully regenerate itself, but only if you act early enough. Now, the part you actually came here for. What can you do about this starting today? Number 1, reduce alcohol even moderately. Even 2 to 3 alcohol-free days per week makes a significant, documented difference. Number 2, eliminate processed fructose. High fructose corn syrup in sodas, snacks, and sweetened drinks is processed by your liver almost identically to alcohol. Every gram accumulates. Number 3, Add cruciferous vegetables daily. Broccoli, Brussels sprouts, and cabbage contain compounds that directly activate liver detox enzymes. This is biochemistry, not wellness marketing. Number 4. Get a basic blood panel. Ask your doctor for AST, ALT, GGT, and bilirubin at your next visit. Catching liver dysfunction at stage 1 versus stage 3 is the difference between full recovery and a lifelong condition. Number 5. Hydrate properly. Your liver needs water to flush waste through bile. 8 glasses minimum per day. Most people are chronically underhydrated without even realizing it. Your liver is working for you every second of every day. It doesn't ask for much, but it does send signals when it's struggling. Now, you know exactly what those signals look like. The only question is, will you act on them? If this video helped you, share it with someone you care about. Most people will go their entire lives without knowing these signs, until it's too late to reverse them. Subscribe to this channel, because next week we're covering something that affects over 80 million Americans, and almost no one is talking about it correctly. You won't want to miss it. I'm Dr. Kyle Healthman from MedAI Clinic. Take care of your body.